You know, you mentioned addiction.
Yeah.
And there is a lot of research that shows a direct link between ADHD and addiction.
Yeah.
And what does your research and experience show about your childhood experience and conditions
Yeah.
and the connection to addiction?
So for 12 years, I worked in Vancouver, British Columbia's downtown east side, which is North America's most concentrated area of drug use. We have more drug users there in a few square block radius than anywhere in the States or anywhere else in Canada. In fact, anywhere in Europe.
Wow.
And so I was there for 12 years. And a significant percentage of my patients clearly had ADHD that had not been diagnosed. Now, let's look at the commonalities. First of all, both addicts and people with ADHD lack impulse control. Like somebody said about addiction, is that the problem is not free will, not lack of free. No, the problem in addiction is not lack of free will, but lack of a free won't.
Lack of a free
Won't.
Oh.
They have nothing to say no with because that circuitry didn't develop. Okay, number one. Number two, addictions all work on the dopamine system, which is what is affected in ADHD as well. So stimulant addicts, like crystal meth addicts, cocaine addicts, nicotine addicts, caffeine addicts, they're literally boosting their dopamine levels, which is precisely what's the issue in ADHDs as well. So if you look at the studies, something like a good 30% or more of stimulant addicts actually are diagnosable with ADHD. But again, this is studied and reported, but not much is done with it in medical practice. Furthermore, all addictions, no matter what they are, they work on the dopamine circuitry. So that I will define addiction for you.
Okay.
As manifested in any behavior in which a person finds temporary relief or pleasure and therefore craves, but then suffers negative consequences as a result of and doesn't give up despite the harm. So craving pleasure, relief in the short term, harm, inability to give it up. That's what an addiction is. Now, let me just go sideways a little bit.
Okay.
Let me ask you a question.
Yeah.
And you've already answered it, but according to that, notice I didn't say anything about drugs. I said any behavior.
Yeah.
Now, if I speak to a room of 1,000 people and I give that definition and I say, according to that definition, which is not controversial, if you ever had an addictive pattern in your life, just raise your hand. And out of 1,999
Yes.
will raise their hands, and there's one liar who won't, but basically it's almost everybody. Now, here's the second question. And I don't care what your addictive patterns were, whether they were to alcohol, which you mentioned, or to whatever else. Not what was wrong with it, but what was right about it. What did it give you in the short term that you wanted? So what did it give you?
Oh, well, with alcohol, it was like a sense of belonging and relief, and it was a way to turn my brain off.
Okay.
And to escape.
Okay. When do people need to escape?
When they're stressed.
When they're suffering.
Yeah.
Okay. So the addiction wasn't a disease that you had. It wasn't your primary problem. It was an attempt to solve the problem of emotional pain and isolation. So my mantra under addiction is don't ask why the addiction, ask why the pain. And if you want to understand the pain, look at the person's life rather than just their genes. Okay? And so both people who are addicted and people who have ADHD often share these genes for sensitivity, which means they suffer more when circumstances aren't right. And so they're both, obviously those conditions will go together. And furthermore, to go back to dopamine, the shopping addict, the gambling addict, the pornography addict.
The social media addict.
The social media, and I have had my behavior addictions.
The gaming addiction addict. The busyness.
You know what they're after? They're after a hit of dopamine in the brain, which they get through seeking that behavior.
And then you feel bad, though, that you did it.
Well, yeah, and I had my behavior addictions, but what I'm saying is it's all based partly on the dopamine circuitry. And
which didn't develop.
Which didn't develop the way it should have. So
because of your childhood.
Exactly. So now you have to get your dopamine hit through pornography. And if you do brain scans on pornography addicts, they get multiple spikes of dopamine hits in their brain when they're...
Just like a drug addict.
Yeah, yeah.
So what do you do with this information? Because it makes perfect sense. Like, I don't I don't know how this would be controversial. It makes absolutely perfect sense.
Well,
what do you do if you're listening to this and you yourself are recognizing this is you, or you're like, you are describing my spouse or my adult child or my parent or whomever in my life? Like, what do you do with this particular information of the connection between childhood conditions and development and ADHD and addiction?
May I just say one more thing about the brain?
Please.
Yeah, opiates. So people get addicted to heroin or OxyContin or Dilaudid, hydromorphone or codeine or whatever, fentanyl, unfortunately, which is a very dangerous one. These are opiates. They come from the opium plant in Afghanistan, or they're human manufactured copies of the same molecule. Now, and it's responsible for a lot of deaths in this country. Now, why does a plant from Afghanistan work in the human brain here in the States?
I don't know.
Well, because the opioid molecule, we have receptors for it in our brains, which means we have our internal opiate system. This is just pure brain science. And the opiate system, it's called endorphins. Endorphin means endogenous, internal, morphine-like substance. So we have an opiate system in our bodies, which affects many functions in our body from the gut to the immune system. But what do they do in the brain? If we understand opiate addiction, we have to understand what do endorphins do in the human trajectory. First of all, they provide pain relief. Both physical and emotional pain relief. Our internal endorphins do that. We have to have pain in life because without pain, we don't survive because we can hurt ourselves. But we also have pain relief. So endorphins relieve pain, but not just physical pain, also emotional pain. Because the part of the brain where people experience physical pain, the suffering of physical pain, it's also where they experience the suffering of emotional pain. So the endorphins, the opiates, work there. That's their first role. The second role, along with dopamine, is to give you a sense of pleasure, elation, and joy. But that's rather important in human life because human life is difficult. So we have to have some expectation of pleasure, joy, relief. That's what the opiates do. That's the second thing they do. But the third thing they do, they facilitate a little thing called love. Endorphins help to feel us connected to other people. And particularly, they help feel parents connected to their kids, without which the child doesn't survive. And if you take little animals and you knock out their opiate receptors, they will not call for their mothers on separation. What would that do to them? It would kill them in the wild. So that's how important the opiates are. Now, who are these people that develop opiate addictions? People whose lives have undermined their opiate circuitry. And I had a sex trade worker in the downtown east side of Vancouver. I asked her, what did the heroin do for you? She said, the first time I did heroin, it felt like a warm, soft hug. So just like the alcohol, which gave you a more sense of belonging, it gave her a sense of being loved, a sense of warmth. That's why people get addicted, is because they suffer that early pain that they're trying to escape from, and because their brain circuitry was affected by adverse conditions so that these circuits didn't develop optimally. And now they have to substitute, so that's the shinny on addiction. It's not an inherited disease. It's a response to the environment, and it's not genetic, contrary to what 99% of physicians believe.
The reason why this is so important is because there is so much shame and self-blame.
Yeah.
When you have an addiction or you have something that you're struggling with like ADHD, and when you understand the brain circuitry and the connection to brain development and human development and childhood conditions and experiences and how that has a direct impact on the working and wiring of the functioning of your brain, you can separate yourself as a human being from the thing that caused this.
That's the whole point.
And then that allows you, from that moment of separation and detachment and objectivity, to go, oh, wait a minute. I'm not to blame for this.
That's right.
This is a circuitry and a conditioning problem.
It's my responsibility.
And now it's my responsibility.
Exactly,
to do what I need to do with this to heal it and make it better.
Exactly right. And to go back to your question about now, what do we do with this information? If you are parents of a child who's been diagnosed with, say, ADHD, then make a considered decision about whether you want a kid medicated or not. Medications can sometimes help. Sometimes they cause side effects. No child should be forced to be on medication because no child at any age should get the message that they're only acceptable to the adults when their brain is sedated. You don't want to give that message to any child. But they can help sometimes to mitigate symptoms. They do nothing for brain development in the long term. So then the question is, can we create in this family better conditions for that child's brain to develop in more optimal ways? And yes, we can. And that has a lot to do with the emotional atmosphere in the family and the degree of understanding and connection. Not love, because that's already there, but the actual understanding and connection between the parents and the child. And I mean, that book's been out 25 years, and I've been told by so often that it totally changed the family just to read that book, and it totally changed their children.
Well, it's very empowering because I think if you're the person struggling with the addiction or ADHD or a condition like that, you feel deficient, that you've done something wrong.
That's
and
right.
You can never heal while you're punishing yourself at the same time.
And the world is punishing you.
Yes.
Teachers are punishing you.
It's true.
Your parents are exasperated with you.
Yes.
When it comes to treating addiction, then it's very complex, but the person, again, needs to understand there's nothing wrong with them. They weren't born with any kind of disease. That addiction is a perfectly normal response to abnormal circumstances. I mean, look at all the veterans who are traumatized and they become alcoholics or opiate addicts.
And then there's the opposite study about the veterans from Vietnam who were using opioids in Vietnam.
Over there.
But then came home to a supportive environment.
Exactly.
And were not addicted.
Exactly. I quote that study in my book on addiction because it's such a salient fact. In fact, it's been done with laboratory rats, where they took laboratory rats and exposed them to different environmental conditions, and they tried to get them addicted to opioids. Now, those rats that were stressed and isolated and under adverse conditions, they very easily became addicted to opioids. The rats who had good conditions, you couldn't even make them addicted to opioids. Doesn't matter how much you gave them.
But the main thing is that if the environment is actually creating the conditions in your brain and body for addiction and ADHD, then the environment is a huge piece of you healing this and growing in new ways and figuring out new adaptations for how to heal.
Well, and I think it's not an individual process. It should be, for the most part, should be, you need the social help. That's what the 12-step groups are. I have my critiques of them, but the 12 steps themselves, I think, are wonderful. And the group process is wonderful, where people can share themselves and be heard compassionately and not be shamed. They can declare their so-called dysfunctions and be accepted. So I think it's not just an individual process, but I think what's missing from the 12-step groups, unfortunately, is awareness of trauma, which is interesting because Bill W., the original founder, was an abandoned child, highly traumatized. And for some reason, trauma hasn't entered the conversation of the 12-step movement.